Welcome to Smiley's Family Medicine.
Hi, I'm Abby Moeller, third-year resident.
And I'm Sarah Coppolas, another third-year resident.
We're both the lead residents for this year.
We're so excited to have you meet some of the current residents and hear a bit about the curriculum for the rotations that they're on currently.
We can't wait to meet you.
Hi everyone, my name is HARB. I'm a PGY1 and I am currently on my OB-GYN rotation. So right now I'm doing a 24-hour shift. Every third to fourth day of this rotation, you'll be working a 24-hour shift at Methodist Hospital in obstetrics, where you follow patients from the very beginning of their labor until the very end, which is delivery and transition into postpartum cares. When we aren't doing call at the hospital, we work at the Women's Health Clinic with midwives doing prenatal care. So this is a very comprehensive rotation because we follow patients from the very beginning until the very end.
Hi everyone, I'm MARGO TOMKA. I'm one of the third-year residents here at Smiley's, and this month in October I am on Pediatric Emergency Department, which means I work over at the Minneapolis Children's Hospital and work with their fellows from anything from a level 1 trauma to the respiratory complaints that come in during RSV season.
Here at Smiley's, and one of the bonuses of our program is that we are osteopathically recognized, which gives our DO residents a little leg up when they're looking for jobs. And we are also working on a track that will get our MDs certified in osteopathic treatment as well, which is great. I get to use OMT almost every day in the clinic. I had an OMT appointment today, and I get to use it on children, adults, all sorts of people.
Hey, how's it going? My name's CHRISTY. I am a current second year at Smiley. Today is our weekly didactics day, and every other week is currently virtual, so I get to learn about COPD and implicit bias from my couch this morning with my cats. All right. Better hop on.
Hi, this is the Smiley's Family Medicine Inpatient Team. I'm Abby, I'm a third year. Our service looks like we have a cap of 12, so 12 patients, and then we extend our cap for up to 2 patients for our own clinic patients, but this does happen rarely.
I'm Rita, the second year. On our team we have an attending, a third year resident who supervises during the day. We've got a second year and the intern, and then we often will have a med student as well. The first year and the second year typically split the patients, and then the med student or the student will work with the second year resident, and typically the intern starts out with 2 patients and then gradually ramps up their patient load.
I'm Sophia. I'm the intern on the team right now. On teaching service, I don't have anything really to add to what's been said, except for the fact that interns do get to go to support group once a week, and our team tries really hard to make sure that we get to that. And we also do have our continuity clinic about once during our 2-week teaching service block, and so the team obviously tries to expedite our help us with our work on those days too, so we can make sure to get to clinic on time.
Last thing we wanted to say was about our teaching curriculum. So on inpatient service, we have the third year and the attending do some teaching, usually around the lunch hour. We keep track of all the lectures that our residents get during inpatient to make sure we have a variety of different topics covered, and we try to tailor it to the patients that are on our service.
So, similar to our other outpatient rotations, as part of the gynecology rotation, we have some usual activities like continuity clinic and nursing home rounds that we take part in. So right now I'm actually on my way into one of the local nursing homes. But the gynecology rotation itself has a variety of really cool experiences. Once a week we spend a whole shift at Planned Parenthood. This is something that many of us really look forward to at Smiley's, getting to learn comprehensive reproductive health care. We also spend time with the urogynecology specialist, the specialty breast clinic, to name a few, as well as Smiley's own gynecology clinic, where we get to really focus our skills on Nexplanon insertion, IUD insertion, etc. So it's a really cool comprehensive rotation, and you can spend more time in these activities if you do an elective. All right, I'm heading in.
I'm KRISTINA PARTHUM. I'm a PGY3. I am currently on my palliative care rotation. which means that I spend most of my week in the hospital with the palliative care team. And it's been an awesome experience that I have gotten to work on my communication skills with patients and families, particularly around like care conferences and goals of care, and also learning more about kind of like medication management of people who are on palliative and helping patients be more comfortable and recognize their goals in healthcare.
Hey, my name's Alex Johnson. I'm a PGY1 here at Smiley's. I am currently finishing up my inpatient pediatrics rotation. I'm here in clinic today. The inpatient pediatrics rotation is definitely one of the more challenging rotations that we get to do. It's 4 weeks instead of the usual 2 weeks. But I would also say, being at the end, though I'm super tired, I can say with confidence that I have learned way more than I thought I was going to learn. I feel much more confident managing really complex medical conditions, along with the more regular ones, asthma, exacerbations in kiddos, appendicitis, and a lot of just like common infections. And I also feel like my ability to work as a team on an inpatient service is a lot stronger than it was beforehand. When you're on the inpatient pediatrics rotation, you will work 3 weeks of days, and then you'll do 1 week of overnights.
Hi, I'm Sarah Kopolis, and I'm one of the third-year residents here at Smiley's. I'm currently on an elective rotation, which I designed as healthcare for the homeless. I'm working with different providers at homeless shelters and doing street outreach around the greater Twin Cities area. You can design your own electives, or you can do preset electives that this program has relationships with different sites. So for example, you can do an inpatient medicine elective. I just finished an allergy elective where I worked with a local allergist. And I really like that flexibility to pick and choose how you want to spend your elective time.
Hi, I'm Emily Fong. I am a second-year resident. Right now I'm on my community health rotation, which in addition to time in clinic, we spend a little bit of time at a local FQHC or federally qualified health center. We also spend some time in an evening clinic that is a med student run clinic. It has med students, pharmacy students, nursing students, and other health professional students, and you work as a medical preceptor in that. We also spend some time observing nurse home visits for PCA assessments as well as developmental assessments.
Hi, I'm Christian Matthews. I'm a PGY3 here. And as somebody applying to sports medicine fellowship right now, they tasked me with talking about the ortho rotations. So in addition to your typical continuity clinic in your first and second years, there are a couple 2-week blocks of sports medicine and ortho. Part of that is you'll spend half a day in clinic here with Dr. Oberstar, our liaison. You'll see patients in rooms. We have x-ray available on site. For whatever a patient needs. We do have injection kits with different needles and typically just steroid injections. We also have newly butterfly ultrasound. We don't use it for ultrasound guided injections, but it is a nice diagnostic tool that we have available in our clinic here. Outside of that, we rotate through a couple other community locations for about half a day with a couple of different orthopedic clinics and orthopedic urgent cares.
So we could go on, but I worry that we'll answer all of your questions before even getting to interview days. Be sure to ask at the faculty and resident meet and greets about other program highlights, such as our longitudinal elective options, support group for every class year, how behavioral health fellows and pharmacy residents augment our inpatient and outpatient training, how safe gender-affirming care is provided at clinic on a daily basis, or even what it's like to move to Minnesota and how we keep ourselves entertained when it's negative 10 degrees outside. You can check out our program's unofficial Instagram account to get a better idea of who the residents are and what we do inside and outside of work. We are so excited to meet you during this interview season. Welcome to the University of Minnesota Medical Center Family Medicine Residency Program, which is a mouthful, and that's why we go by our clinic's name, Smiley's Family Medicine.